Thank you very much, everyone. Good morning and welcome to today's Holland Health Wellness webinar. We are thrilled to have you join us. At Holland Health, we are not just about providing health coverage, we are deeply committed to empowering our members with the knowledge and tools they need to take control of their health and well being. That's why these webinars are so important to us. Not only do they serve as an avenue for knowledge sharing, but they also allow us to demonstrate our dedication to being thought leaders in the health and wellness industry. Today, we are talking about a wellness tool that is available to all of our members, which is the Teladoc service. We are excited to introduce our guest speaker from Teladoc, their Business Development Senior Director, Mark Espel, who will be talking you through the amazing benefits of Teladoc services like the Telehealth Second Medical Opinion and giving practical tools to up your wellness game using them. So without further delay, let's get started. Mark, the floor is yours.
Thank you. Thank you very much for the introduction. I'm happy to be here today with you to share our services and how this can impact your life, right? And help all of you be healthier wherever you are. So, without further delay, well, here you have my introduction. But basically, I've been in Teladoc over 5 years, and since then working well with Henner and then of course with Holard, providing these services, and happy to be here, as said. So let's going into the explanation of our services. First of all, we'll start with the context of the company of Teladoc Health, of who we are. So we just want to share with you that we are the global virtual care leader. So at Teladoc, we have, for instance, only in the USA only, more than 100 million users, right? You can see in the map our broad scope worldwide. Of course, you will see no dot in Africa. Just to clarify, what we are seeing in the map is where we have operational offices. I mean, we have doctors all over the world, including Africa, in every country in the world almost. But here in the map, we just show the how broad is our company in terms of, let's say, other than medical staff like me, for instance, or like HR, IT, or whatever. So we are covering from Australia to China to Canada or to Latin America. We have more than 5,000 employees worldwide. We have delivered historically, I think it's already 70 million consultations, and we are a company that's publicly traded in the New York Stock Exchange, so we're a solid company with more than 2.5 billion, with a B, more than 2.5 billion dollar yearly revenue. So, moving into the services today, as said in the introduction, we will be explaining the two services that, as insured members of Holard, you have access to. One is the primary care consultations or GP consultations, and the other one is the international second medical opinion or expert medical opinion. Starting in the GP consultation services. So this is basically, before I start sharing you the slides, this is basically a primary care services for whenever you need to talk to a doctor, say quickly. Of course, it's not an emergency service, meaning that for, let's say, urgent issues like bleeding or losing consciousness and so on, of people would need to call an ambulance or go to emergency room. But for primary care issues such as fever, sore throat, or problems in your skin, or whatever primary care issues for which you would typically go maybe to a doctor or to emergency room, you can use this service from the comfort of your home, your work, or from even from the airport, from wherever you are. You can get in touch. A doctor will be calling you on the phone, or you will have a video meeting if, in case you have internet and a good location to connect. You will be able to talk to one of our doctors. So, how is this about? First of all, we want to explain that what we are delivering to all our members, is what we call the truly global primary care solution for global populations. We as Teladoc are putting in place for you a global network with more than 2,000 primary care physicians with almost immediate availability. So typically, when you can request, you will see later in a demo, but you can request talking to a doctor, either scheduling a session. Imagine you are busy in your meetings and you're not feeling very well, but you want to take, let's say, your lunch break to talk to a doctor. You can schedule it already in the calendar, and then you have a video session, or you can request to be called as soon as possible. In case that you request to be called as soon as possible, this typically happens in less than 1 hour. In case there is a peak on demand, it could take maybe up to 2 or maximum 3, but typically in less than 1 hour, a doctor will be calling you into your phone. This service is available currently in 6 languages: English, Spanish, French, Portuguese, German, and Arabic. And then the third point that we are highlighting here, I would like to stop here because we talk about the quality oversight from medical directors in various regions. What does it mean? It means that we as Teladoc, we are not a tech company. Let's say we are not a software SaaS company, like a software as a service company. We are a medical company. We are accountable of our doctors, of the medical interactions that they have, let's say, with you, right? So we want to emphasize this, that Teladoc as such is not like a cloud marketplace where, let's say, random doctors connect and you connect there and talk to a random doctor and that's it. No, Teladoc is a medical company. We have our medical team of doctors that we will explain further on. But these doctors report to their medical director that oversee. They are, let's say, responsible for the cases they deliver. We review the quality, etc. So this is something that differentiates us in the telehealth arena, right? So this is our priority. Having said that, we are not a tech company that does health. We are a medical company that has tech, which is different. The last point is that we want to highlight this seamless digital integration. So we are, of course, a medical company, but we are a telehealth company. So of course, tech is very important for us. And you will see later on in the demo video that you can access all these services through a seamless digital integration with your Whole Art app, General Whole Art app. You can access there and directly come to our services and request what you need. Moving forward into the detail of these primary care consultations, we want to share the main highlights of this service. So this service is brought to you through an experienced team. So our GPs, our doctors, have more than 6 years of professional experience on average. Quality is in our core, right? So we of course work always with licenses, GPs and physicians, and those doctors are not only trained by us when they start working with us, because as you can imagine, it's not the same to deliver a face-to-face consultation in a clinic than delivering it through the phone or through video. So we are training all these doctors when they start working with us, but not only at the beginning, also recurrently during the year. They are having refresh, what we say here, regular appraisals and continuous training. Third point that we want to highlight besides that is that they are updated and active. What does it mean? It means that we are always contracting, let's say, doctors that don't work full-time with us. They are always part-time with us because the rest of their time they are typically practicing in their hospitals or clinics. So a regular doctor that could attend you through this service would be a doctor that probably, let's say, Monday and Wednesdays is in a public hospital, Thursdays and Tuesdays, maybe this doctor is in a private clinic, and some hour of the week they block themselves to work with us because they like it, let's say. And then you have also the comfort of knowing that the doctor that you're talking to is working a lot in the virtual arena, but it's also in the day-to-day with other patients, so they don't lose this contact with the medicine, let's say. Objectivity, it's an important point for us. We are only a virtual company. We don't have, let's say, brick and mortar clinics, so you will receive 100% independent advice. We don't belong, or we are not affiliated with any hospital group, so there will not be, let's say, any hidden incentive to bring you to a face-to-face facility, where our doctors will just try to give you the best for your health. Next point, availability. Well, this service is 24/7, 365, so it's very convenient whenever you need the service, even if it's in the middle of the night. This is unlimited, so there is no limit in consultations you need. Just if you have the need, you can request it. And the last points, the IT integration I mentioned before, and you will see it soon in a video, how this is integrated into your Whole Art app, and in which we keep here the last point that says interactive, is that whenever you request a consultation, you will be able to upload any scan, image, blood test that you had in the past, so that our doctor can carefully review it before the consultation with you, and vice versa. Doctor will be able to upload for you any document or maybe a prescription and any suggestion in treatment and so on. They will upload it into your profile so that you have this information always there, ready to see whenever you need it. What's the outcome of this service, right? What happens when any of our patients, any of you uses these services? We have some statistics here, right? And what we see is that, well, once you use the service, after that, you will receive a survey, a quality survey, which is very important for us that you reply to the survey, even if the service was perfect, or if you had any problem, or if it was okay-ish. For us, it's very valuable to hear your feedback. We send service to each and every patient using the service, right? One of the questions that we ask you when you receive the service is, what would you have done if you didn't have this service? And then what did you actually do thanks of having the service? And what you see, it's quite consistent across the board. You will see that typically 2/3 of the patients told us, well, I would have gone to see a doctor. Or 12% say, I would have gone to an emergency room. So only 20% would have stayed at home. What does it mean? These are patients that would have probably taking the car or taking whatever transport they need to do. They would be skipping a job or family to go to a doctor, wait, be attended, then commute back, etc. So they would be investing quite a relevant amount of hours in having their health issue solved. What do we see after that? Is that thanks to the service, more than, well, around 62%, it didn't need any other health interaction. We call it they stay at home. Maybe they went to the pharmacy to pick up some medicine, but the point here is that we manage that 2/3 of the members don't need any other interaction, and they can solve this virtually. We are very happy about sharing that typically 2/3 of our patients can have their health issues solved just virtually, remotely, from their home or from their work or from wherever they are. And of course, the question that comes now is, what about the other third? Do you mean, Mark, that the other thirds are losing their time? And that's definitely no. They are not losing their time. We are also impacting this other third. In this case, it's 38% of patients. We are already giving a positive impact into them. Why? Because we are giving this kind of triage work for them, right? Sometimes we have patients that would have gone to an emergency room, and thanks to our consultation, they know that their issue is not urgent, and then they can go directly to see the specialist, and they know which specialist to visit, and then they can look into their app and look which specialist they need to ask for a consultation in the future, right? So what I mean here is that these other 38% of patients that don't get their issue solved straight away will also have a benefit of using the service, because they will already know how severe or mild their condition is, and they will have already some guidance on what to do moving forward. How is this accessible? Well, as I was saying in previous slides, this is accessible through the member app. You will see here in My Services, you have Discover Medical Teleconsultation now, provided by Teladoc and Center. You can click there, and then you will see the two services available, which is the second opinion that I will explain later on, and the general practitioner, the primary care service that I've just explained. We have a video for you to understand how, let's say, user-friendly and simple is to access it. A small disclaimer I like to make is that in the video, you will see the experience in a desktop, in a computer, while you have the access through a responsive web portal in the phone. So long story short, what you will see in the video is the same that you can do in the phone, but of course, let's say the resolution is different, right? You will see the experience in a computer, but you can do exactly the same through your phone, through your app. Going to play the video right now. I hope you can hear it and see it properly.
In an instant, health concerns can arise. But with Teladoc Health Services, expert medical support is always within reach, anytime, anywhere. Whether you need 24/7 access to a doctor through our general medicine service, or a trusted opinion for a complex diagnosis via our second medical opinion, Teladoc Health is here to support you. Easily request a consultation by logging into the online portal, selecting the My Services, and receiving medical advice wherever you are. Once inside, we'll create your profile with just a few details: email, name, last name, birth date, gender, country, phone, and language. Then agree to the terms and click Send. Once logged in, choose the type of service that fits your need. Choose whether you'd prefer a phone consultation or video consultation. Select the patient, type of consultation, language, time zone, and a suitable time. Describe your issue and attach any documents if needed. Verify or add a phone number. It is essential for this step. Your request is now confirmed. If you selected a phone consultation, a doctor will typically call you within 3 hours. For video consultations, your appointment is already scheduled at the time you selected. Just be ready to connect at that time. Facing a complex diagnosis? Choose our second medical opinion service. A dedicated physician case manager will guide you and connect you with a world-class expert. You'll receive a detailed medical report and clear recommendations. You can track all your upcoming consultations directly in the portal. Need to make a change? Click in any of your upcoming consultations. You can easily cancel your appointment anytime. From diagnosis and recommendations, Teladoc Health empowers you with trusted medical support wherever you are. Teladoc Health, your health simplified.
So we hope that with this video you had the chance to get a flavor on how, let's say, user-friendly and simple is to use to request the service. And as a summary, as I said before, for primary care, you can just request being called back as soon as possible. We said less than 3 hours. I can tell you that the average is less than 1 hour. Or you can schedule a video consultation at the time that's more convenient for you. What about if you need a second opinion, right? We are going to explain now the second medical opinion services. This can also be requested through the same process, just picking up the appropriate service. But what's this about, right? Let me explain it in the next slide. So this is a service meant for complex conditions, mainly, and we explain it here. Like when complex condition is diagnosed, a lot of doubts and questions come to mind. We have 4 quotes here that I think that explain very well what the service is about. The first one, for instance, in the top left, you see, something is not right with my daughter's heart. I need a cardiologist I can trust. Then another one in the top right, my oncologist recommend me radiation and chemotherapy. How do I know that that's the best for me? So as you see, these are 2 complex issues. Or for instance, in the bottom left, you will see something that might be relevant for some of you that say, I am living in a foreign country and I do not fully trust the doctor recommendation. Would the advice be different if I was talking to an expert in my home country? This is a concern that many of us have had or will have in the future. Or the last one in the bottom right, where we say, okay, my orthopedist recommend me surgery, but I am not sure that I'm ready for that. How do I know that it's the right time to go into surgery? So in any of these cases, there are examples of cases in which you, let's say, would be eligible for a second medical opinion. To be clear, so this is a service not suitable, let's say, if you have a flu, let's say, or if you have something very, very mild, right? The idea here is complex conditions or things, that are really impacting life. And at the end, what the patient needs to be eligible for this service, they need to have already a diagnosis and a treatment plan. That's why it's called second opinion, right? You already have a diagnosis and a treatment plan. You're not convinced about it. You have second thoughts. There are questions on your head about it, and then you request this service. What do we do in the service? We illustrate it with 3 main pillars. We say that it's a service that follows a guided process with the best-in-class experts and with the highest impact. I have one slide to deep dive in each of these 3 pillars. But before I deep dive into it, I want to share with you that the service itself, what we do is we take your case, we assign you a doctor, which will be your case manager, and this doctor sends your case to a worldwide expert. What's an expert? You will see it in the following slides, but basically we work with the best renowned experts in the world, medical doctors, medical experts in each and every medical field, so that one of these doctors, that could be a professor in let's say in Mayo Clinic or in Harvard Medical School or whatever, they will review your case and give their opinion on your case so that you can have the peace of mind of what to do next. Diving deeper into these three pillars, I'll start with the guided process, then I'll go into the explanation of the experts, and finally on the impact. So, about the guided process, how does it work? So you can start the process through different channels. So typically you will start it through the app, right? And then you will be assigned what we call the case manager. Very important. This case manager is always a doctor. It's not a nurse. It's not a call agent. It's not an admin team, let's say. It's always a doctor that will always be native speaker of your language. Okay. And more importantly, this doctor will be the unique point of contact for you along all the process. We know that patients in these situations, they don't want to be talking to, let's say, 10 different people, or to, you don't want to be disturbed with many different interactions. So we assign this one and only single point of contact, a doctor, speaking your language, the case manager. So case manager will work with you in gathering all the relevant information and understanding your health concerns. Case manager will also be helping you to gather additional information if this is needed. If you need an additional blood test, an additional scan, or whatever, the case manager will suggest you to do it, and then you will have everything ready. Then when everything is ready, the case manager will create what we call the clinical summary. Then our board of experts, of our board of, let's say, of doctors for second opinion, will select the best medical expert to review this case. At this step, we will also maybe translate your medical records. Why? For instance, if the selected expert is, let's say, in the US and speaks English, and your medical records are in French or Portuguese or whatever language you speak, we will translate all of them into English so that the expert can review them properly. And then the expert will review all the information and will do a second opinion report, a detailed report about what they think of this diagnosis, what the treatment they suggest, etc. And then they will issue a report. This report will also be translated back if needed. So again, if your language is French, Portuguese, or German, or whatever, the case manager will be in charge of translating this report, and then they will deliver to you both versions, the original verbatim version as the expert wrote it, and the translated one. Not only this, but as we say in the last step, the case manager will provide a detailed explanation of the report result and will ask any question that you have. So you will not only just receive the report, but you will have the chance to discuss it with your case manager. So they will clarify anything that you don't understand from the report, any other question you have. This will be clarified for you. So at the end, it's an end-to-end process with your case manager, in which we, as Teladoc, we get in touch with this top expert in the field that you need information about, and this expert will review your case to give you peace of mind on how to move forward with your health. Second pillar, we say that we work with the best-in-class expert. What does it mean? So it means that we have our network of more than 53,000 physicians worldwide, covering basically, you can say, each and any medical specialty or subspecialty in more than 20 languages. And very important, our process. You say, okay, how do you know that you have the best? Well, basically, no one can, let's say, write us or join, let's say, us just online, or no one will call us and say, I want to be an expert for you. No, this doesn't work like this. What we do is we follow what we call a clinical peer recommendation process. It means that regularly we are updating our database, and what we do is we look for these key opinion leaders, for these top doctors like university professors and so on in the world, and more renowned experts. They typically have, let's say, publications in renowned magazines and so on, and we add them into our database, and we also ask them to point us out to the experts in their areas, right? So for instance, like the example that we saw before, a problem with my daughter's heart, and I need a pediatric cardiologist, we would typically ask the best cardiologist in the field, if your daughter had this problem, which peer would you go to? So this way, we make sure that our network is only filled by the best experts and the key opinion leaders, the most renowned doctors. We, of course, verify their licenses and the credentialing, so meaning that they are really, as said, doctors that have publications in magazines and so on, so that they are really renowned. And the last one, the matching to the member using multiple criteria, right? So as said, if you have, let's say, an oncology case or a surgery case, for instance, we will not be looking just for oncologists. We will be looking for the oncologist that expert in your issue. Or if you have a hip surgery with a replacement of something special, let's say, we will not be looking for just a surgeon or a dermatologist. We will be looking for the expert in that specific replacement that you're looking for. How does this translate in specific experts or in specific places? We have in the next slide, of course, it's only a sample because I think we have like 12 only as a sample of the thousands of experts we have. But what we want to share in the next slide is an example of places in which our experts work. Again, we are not affiliated with any hospital. We have not any commitment with any of these top hospitals. We have these doctors in our network that typically work with us, but for you to get an idea, we have highlighted here the places in where they belong, let's say typically, the doctors that work with us. So you see here places like Harvard Medical School, University of California, Cleveland Clinic, Cedars-Sinai, Mayo Clinic, okay, again, Harvard Medical School. So these are the kind of experts that we have in our network. So whenever you have a complex case, you have just, let's say, 2 clicks away, you will have one of these doctors or one of these thousands of doctors, but all of this level of expertise reviewing your case and giving an opinion on what to do. And then last pillar, all of this, how does it translate in the impact in what you see? So we have a service with more than a 90% user satisfaction. And then we measure these KPIs on diagnosis and treatment improvement. First of all, diagnostic improvement over 37%. So it means that more than 1 out of 3 of the patients that come to the service, the diagnose, so I'm not talking about the treatment yet, I'm talking about the diagnose, the reality of what they have is improved or changed. So somehow the diagnosis was not 100% accurate, at least to our expert's standard, and then our expert will change something of the diagnosis. This is quite impactful already. Then treatment improvement, 71%. So around 70% of the patients that come to the service, they are suggested to do something different to what they had been suggested before. So they come to us telling us, well, showing us their medical reports, saying, okay, I've been diagnosed with this, and I'm suggesting, and they have suggested me to do that. So only, let me put it the other way around. Only 30% of them are said like, okay, your treatment path was good, everything good. So these ones are very happy because they get peace of mind that everything is going well. But it's very impactful to see that 70% have some change in the suggested treatment, right? And then you will see below that we have this sub KPI. It's a sub KPI on the treatment improvement that we call it the avoidance of surgery. So we specifically measure those patients that land into the service because they have been recommended surgery. So we track this, and what we see is that for every 10 patients that request a second opinion because they are going or because they have been suggested surgery, have been suggested to do a surgery, or they are going to undergo a surgery process, out of 10, 3 are recommended not to do the surgery, not to go into the surgery room. So this is a very impactful KPI for us, right? And not only, I mean, because of providing a better treatment to them, but because of the fact that avoiding surgeries is something very, very relevant. And sometimes, depending especially in the country where the patient is, there are places that we know that there is let's say, a tendency to overtreat, or that the doctor might have, let's say, a hidden incentive to just go into the surgery and to do this procedure to you. Well, maybe it's not the best option, right? So we see that 30% of the patients requesting the service with a surgery recommendation, the final recommendation of our global expert, as I said, top expert, key opinion leader, is no, don't go into the surgery room. So this is also very, very relevant for the services. And then what we have here, just quote from patients saying, for instance, the assistant's understanding of the situation is available. And of course, we have many good quotes from our patients that end up building this over 90% satisfaction. Since we love the quotes that our patients give us and what the patients say to us after using the service, we have also some testimonials for you, some real examples to share. So the first one that we have is one here. In this case, it was a patient in Europe. You will hear it right now. But what we like to showcase with this one is that, as I explained, the service is meant typically for oncology, like cancer, not oncology only, but critical things like oncology, heart diseases, vascular, brain, and so on. But not only this, you will see now the example of a patient that was living with pain in her face during several amount of years, as she explained, and then she found out about this service, and thanks to that, after a lot of years thinking that she didn't have a solution for their daily pain in the face, she finally found a solution. So it's just an example of how impactful this can be.
My name is Dorota. I'm 37 years old and I'm originally from Poland. However, I was lucky enough to live in a few countries in the last 10 years. And currently I'm staying in Spain, working in Gibraltar. Since I was 8 years old, I was suffering with the face pain on the right side. And only when I was 15, I was diagnosed with trigeminal neuralgia. Since then, I have been only taking painkillers, naproxen. There was nothing really to prevent the pain. And the pain is pretty constant. There's very rarely when I have a week without the pain. We did tests. There was never really any solution for it. There was just things to prevent the pain once it's happening. And when I moved to Gibraltar and we got the insurance, I found out about the Teladoc service from the email. I didn't expect much any new revelations when it comes to my case because, like I said, I've been treated by many doctors and in many countries. However, the final report provided by the Teladoc, it literally blew my mind because it was 18 pages of description of absolutely everything since I was 8 years old, including translated medical documents from Polish to English, which has never been translated before. And for me personally, there was a lot of information in this final report, a lot of solutions that already included change of medication that I had quite bad reaction to the first ones. And then the Teladoc recommended something similar, but with less side effects, and it works fine. And also they provided different options for the actual surgeries, some more invasive, some less invasive. And that's the list that I came back to the neurologist with as well. I didn't really have to do much. Everything was provided by email, and every message I get, obviously I get notification, and the response time is very fast as well. I didn't even expect the final report. I just thought I'm going to be getting a little piece of advice now and then. And the time when I even called my mom to tell her, you won't believe it, it's 18 pages, everything is there. So it's really, really helpful. I wouldn't be able to do it probably, or it will take me a long time to actually put it together like that.
So as said, you had here the example of Dorota, and yeah, she had this page, she was living with it, and finally she saw that she had this service like you will have available, and she said, okay, I will try to see what happens here. And then she discovered that there is something to do, right, to change medication. Now she's much better. She explained us how surprised she was of the 18 pages, everything translated from Polish to English, so she had everything in the two languages whenever she needed, and it's 18 pages all gathered there, well clearly explained by the case manager. So she was so happy about that she asked, she was telling us that she was really happy for our marketing team to fly in to her home and record this video. So yeah, okay, this is some case that was here in Europe, and you will say, okay, how close is this to me? So we also have, not in video format, but we also have for you to finalize a real example of a whole heart patient in Mozambique for a neurology case. So basically this was for a 14-year-old kid. So basically you see here the quote of the parents, right? Saying, they told us, like, hearing that our son didn't need immediate brain surgery lifted a heavy burden. So you can imagine, right? These parents with a 14-year-old kid that they suggested to do a brain surgery, and suddenly after using the service, you got this expert, which is it's professor in the University of Miami, right, saying that the surgery is not needed. So they keep the quote saying, we feel more confident with this coached approach. Following up with an MRI to confirm stability feels much safer than risking your 14-year-old kid into surgery, right? So basically, just to see below the description, there was this guy, this boy from Mozambique that was diagnosed with this cavernous angioma. So it's a benign blood vessel abnormality in shocks to your brain, right? And this means that the kid had persistent headaches, diseases, nausea, right? And there was a local neurosurgeon that, probably the neurosurgeon was 100% wrong. I mean, it was a procedure that was valid, but the surgeon said, okay, you need to have immediate surgery. In this case, recommended to do the surgery abroad. So the family, as said, was really happy because they could have this reviewed by a professor of neurosurgery in University of Miami. And after reviewing everything very carefully, as you can see in the bottom right, the professor confirmed that the angioma was benign, that there was it was probably there since the kid was born. There was a minimal immediate risk, like less than 1%, and he thought that the immediate surgery was not needed, right? And since these symptoms were more migraine related than the lesion itself. So at the end, what the doctor recommends is a conservative approach, having some follow-up MRI each year to confirm stability. So this is an example of something that could happen to, well, any, let's say, of your kids or to yourself, right? Where you are suddenly, well, suggested to do something as impactful, let's say, as a brain surgery. And of course, if you get another doctor saying, no, don't do it, you will see, okay, who do I trust? But when you have, let's say, the stamp of knowing that a professor of neurosurgery, in this case in a University of Miami, tells you, no, you are okay not having the surgery, then of course the peace of mind that you get and what you bought at the end of the day, it's very relevant, right? So we're very happy to be able to deliver this service to you and to give you this peace of mind for your improvement in your health. And I think that's it. And we can, well, I don't know now if we should open to questions or how to move forward, but
Correct. So that is, how is Teladoc services charged?
so here I don't know if I should be me answering this one, but basically this is, as I understand, this is included, right, for all of you in your policies. So it's free of charge for all of you. You, with your whole art coverage, you have this accessible, unlimited, and you can use it whenever you need it. I think
100%.
that should be the answer, yes. Then do you have contact telephone number that we could call? So the main door of entrance is through the app. So once you request the service there, as said, you will be assisted by a doctor, and typically in less than 1 hour. So the answer is no, that you can access it through the app whenever you need it. And in case there is any problem when the doctor reaches out to you, of course, they will be supportive, or they can put you in contact with an agent team or through email in the case you need to reschedule anything. I mean, we have a operations team working on that, but not a calling line. And then I see error after downloading the app. I think this is not the right app. We just because this looks like, maybe I'm wrong, but this looks, Gaki, that you probably download the Teladoc app, because, I mean, there is a Teladoc app that's for the USA customers. It's besides that. So I'm not sure which one you downloaded, but what you need to access, and let me go back in the slides, and here Whole Art team can help me, but I think it's the My Whole Art app, or what was the name of the app that they need to access?
It's My Holland, correct. So it's going to be purple on the what is this? On the store. So that's either your Play Store, Google Store, or Apple Store. It's a purple. So it's got a big H in purple on there. So once you are a Holland Health member, right, and you sign on, so you receive what we refer to as your welcome email. Once you've signed on to the app or onto the portal, you are then able to access the Teladoc functionality. But what I'm going to do, perhaps I'm going to just show you on the member portal. This is the portal which will be on your laptops or desktop, how you can access that. Okay. And what it typically looks like via the member portal. So once you've signed onto the portal, this will be your landing page on the portal. And then all you simply need to do, you click My Services. Under My Services, that is where you will be able to find, number one, your network service providers. And when you scroll down, there it is where it says Medical Teleconsultation, Teladoc by Henna. And then what you'll then do is you'll click where it says reach a doctor. But unfortunately for me, this is a demo account, so my functionality is limited up to here. But once you've signed on to the portal, as I've explained, on your landing page, you will simply go right at the top where it will have multiple search options. You will click My Services, scroll down, it will show you the medical consultation, which is Teladoc, and you click Reach a Doctor. Once you click there, it will then take you to open up the next page. On the next page, you will then have the option for primary consultation or a second medical opinion.
Next one I see in the chat is free. Does this mean none of the services provided by Teladoc are locked under the benefits of the Whole Earth Health Plan when utilized? Well, I'm not sure about the answer here, but I understand, yeah, that this is. So I leave this one to you also.
Okay, let me see. Free. Does this mean none of the services provided by Teladoc are logged under the benefits of the Whole Health Plan when utilized? Good morning, Eric. So these services, not necessarily that they're not logged. Yes, they are free to the members. However, I think there is somewhat of a minimal fee that we, interchange internally between ourselves and the team, but we don't charge the members directly for these services, if that is what you're asking, if I'm understanding your question correctly.
And while Eric confirms if this was the right understanding, I see the next one. Well, thanks so much. No, thanks to you for attending. Just to be clear, can a doctor prescribe medicine on a script through the Teladoc service? Good question. I was expecting this one already. So it depends on the country in which you are based. So yes, our service can issue prescriptions, but depending on the local regulation on each of the countries, it's not 100% straightforward. So you would get sometimes what we call a medical recommendation, which is just let's say a kind of prescription from our doctor, because the doctor might not be based in your country. And with this, you can go to the pharmacy, right? So it depends. It depends on when you're based, in which country. There are countries that have, let's say, 100% official process of issuing this prescription after teleconsultation. And in these cases, we are as Teladoc are integrated with the systems and you can have your prescriptions. But there are countries, let's say, less developed in that. So at the end, sometimes in these countries, the doctor will issue a prescription, but it will not work 100% of the times. So long story short, whenever, due to the medical criteria of the doctor, the prescription is needed, and legally it can be done through a telehealth service, yes, you will have it. So if you consult a doctor online and they need to do further tests, lab or otherwise, where will they send you to carry out this test? Asking from Nairobi, Kenya. So I think that the answer here is that you need to, so our Teladoc doctor will not tell you where to go. It will tell you that you need this, will prescribe you the test, and then you need to look into your Whole Earth app, right, to find the appropriate labs for this to be done.
Correct.
And then Patricia is asking if this can be accessed from any country. Yes, from your home country when you're on holiday. Yes, and what's also one of the big benefits of this. So, for instance, when we were asked about prescription, right? Imagine, and I'm putting the example that is close to me. Because I'm based in Barcelona, Spain. I will put you this example. Imagine that you're traveling into Spain, right? And you don't feel well. Yes, you can access this service. And for the prescription example that was put before, for instance, our doctors in Spain, they are all of them integrated into the platform that all the pharmacies in the country have access to. So if they need to prescribe you something, the pharmacy itself, they will directly receive it online, your prescription, you get the medicine. And this will happen also in the US or in many European countries, Southeast Asia, other African countries. Wherever you are in the world, you can use this service. And that's quite valuable, right? And differentiating. Next one. Not sure this is meant for here, but is Scholar considering wellness costs for members who have doctor recommendations, for example, attending the gym on specific days to heal up? So I don't know. This one, I think it's not for me.
Yeah, it's definitely not for you. And I'm not sure if I'm understanding it correctly. Let me just read it again. This is meant for Holland considering is Holland considering wellness costs for members who have doctor's recommendations, for example, attending the gym on specific days to help heal up. So that would gym attendance, right? That would then, depending if it's meant to be physiotherapy, right? Because remember, if the doctor is recommending any type of physical movement or activity, it wouldn't necessarily be directly gym, but it would probably be physiotherapy or chiropractic type of services. Those are covered, but again, it will depend on the type of level of cover that you have and the chosen benefits, but not gym. No, gym would still be, in terms of support that we offer to the members, there is an app that is called Health Move that we do provide, to members in terms of support, additional support in that regard, benefits that they can reap by utilizing or engaging with the Health Move app. But in terms of gym membership or support in funding for gym membership or attendance to gym, that is not something that we can unfortunately provide to you. But as mentioned again, in terms of support and making sure that you are fit and you are healthy, and we do provide you, some sort of reward in that regard, there is Health Move or the Health Move app that you can engage with. Bernard, I think
Yeah.
this one we had touched on earlier. So, in order to access Teladoc, you would need to go via your member app. So, your Holland Health member app or portal, sign in or log in. So it wouldn't be directly through Teladoc.com. I think Mark had mentioned earlier that Teladoc.com is a US-based type of app in terms of
Correctly. Yeah.
connectivity and access. So for our Holland Health members, you would need to sign on to the member portal or the app. And when you go under My Services, that is where you will be able to access Teladoc. Yeah, it seems like we do not have any more questions. Thank you so much, Mark, for taking the time to join us and
My
providing us
pleasure.
such rich information with regards to Teladoc. Believe it or not, I've learned a thing or two myself. We really do hope to see, more of our members also engaging and joining us for such webinars and interacting as you have in the chat. So thank you to you as well. And thank you once again to our audience for taking the time to join us and, providing your questions and any feedback that you have experienced with any of our apps or engagements. And lastly, remember, you are also able to join or rather rewatch the webinars that we have engaged in previously. So you can play a bit of catch up in that regard via the hollandhealth.com/video guide. So I will also just pop that in to the chat where you can just quickly click on there and then be able to watch our previous webinars that we had already hosted for you, which are also recorded, and you can play catch up in that regard. And yeah, thank you so much for taking the time again. Once again, taking the time out of your busy schedules and joining us. And remember, we do have another exciting webinar coming up on the 14th of August, which will be about the incredible power of sleep. So believe it or not, there is power in sleep. Okay, so in order to get more information regarding that, please do join us on the 14th of August, 2025. Okay.
Thank you.
Thank you so much, everyone,
Have
and
a nice
have a
day.
great day further.
You too.
Thanks,
Bye.
Mark. Bye-bye.
Bye. Bye. Bye.